Hi, this is Dr. Alicia Rulaz. I'm a psychiatrist that teaches at UCSF, and I'm also developing classes for the continuing education program at Alliant International University. Today I'd like to speak about a recent study in the Archives of General Psychiatry. And in this study, researchers were looking at that complex problem of how to help people who have been treated for depression to keep from relapsing. So we know that people who have had one episode of depression are at a risk of having another episode. So how do we prevent this? Well, what these researchers did is they divided people who have been successfully treated for depression with antidepressant medication into three groups. For one of those groups, they did what is currently the standard for relapse prevention, which is to continue the medication. For the second group, they had them take a placebo medication. So it looked the same as their antidepressant, but obviously had no effect. For the third group, they had them try something called mindfulness-based cognitive therapy. And you probably have heard of cognitive therapy. And the idea behind cognitive therapy is that our thoughts can cause emotional reactions within us. If we have negative thoughts that we are consistently reacting to, it can go into a negative mood state like depression. But what about mindfulness? So what does adding mindfulness to cognitive therapy do? Well, mindfulness is based on an Eastern practice. It's often used in meditation. And the idea behind mindfulness is that we want to be able to be within the present moment completely present in this moment. And what that means is having an awareness of what's going on in this moment and not reacting to it, not judging it, just allowing it to be. So one way I like to think of this is I enjoy scuba diving, and when you're scuba diving, the surface of the water can be very, very choppy, but that doesn't mean that it won't be calm underneath. If you keep going down as you scuba dive, you'll eventually get to a place where the water is very calm, regardless of what's going on the surface. So mindfulness is kind of like that. There's this calm center within us, and if we can get to that center, we can tolerate whatever sort of turbulence is going on around us. So how does this work in with the mindfulness-based cognitive therapy? Well, you can imagine that if people were taught not to react to their negative thoughts, negative emotions, negative things in their environment, that they'd be less likely to be affected by them. So if we're less affected, we're probably less likely to go into a depressive state. And this has been shown in brain scan research looking at mindfulness. So one thing that we know from brain scans is that people with depression are more reactive to negative things in their environment. So negative stimuli they're hyper aware of. And the place where they react is at the amygdala. So if you remember, the amygdala is in the primitive part of the brain. This is where we just have emotional reactions, not things that we analyze. So if the amygdala is reacting more to negative stimuli, we've also seen that the amygdala doesn't react as much to positive stimuli in a depressed individual as opposed to a normal individual. So if you're scanning your environment and reacting a lot to the negative stimuli, it's easy to see where one might slip back into a depressive state. What has been noticed in brain scans is that after people go through a mindfulness training for several weeks, their brain reacts differently to negative stimuli. So it's no longer so reactive in the amygdala, but rather the prefrontal cortex reacts. So if you remember, the prefrontal cortex is in that higher ordered thinking part of the brain. So during a mindfulness practice, rather than reacting emotionally to negative stimuli, people are taught just to label, this is anger, this is sadness, this is disappointing, whatever's going on. They're taught to label it, to put words on it. And when they do that, they're activating that prefrontal cortex. After several weeks, it becomes a habit for the brain to use the prefrontal cortex rather than to go straight to the amygdala's reactions. So what this means, and this may be what was so powerful in this study of mindfulness-based cognitive therapy, is that people no longer react to those stimuli, but they're just labeling them, and they can continue on without having a relapse. And that's what was found in this study, that the people who were taking the medication did not relapse, which is what we would expect. That's been shown in other studies. People taking placebo were more likely to relapse, but the people taking the mindfulness-based cognitive therapy intervention were on par with those taking the medication in not having relapse. So perhaps it's because they were less reactive. We can't know for sure, but this is one thing to keep in the back of your head as an idea for helping to treat your patients who don't necessarily want to continue medication but are at that higher risk for relapse. So again, this is Dr. Alicia Rulas. Thank you for listening, and I look forward to speaking with you again soon.